Hello, this is Abhilash. I am a second year medical student. May I know your details, please? I'm Dovin, 20 years old. Today I am going to examine your eye and ear. This causes little discomfort. Is that okay with you? Yeah, it's okay. Now we'll start with ear examination. Examine external ear for any kind of tumor or pus formation and palpate the masthead bone just behind the ear. Tenderness in the masthead bone causes mastoiditis. Okay, now I'm going to perform whispered voice test. Stand 2 feet behind the patient so that patient can't read our lips. Gently rub the tragus in a circular motion to prevent transfer of sound to the non-test ear. Whisper a combination of three numbers and letters such as 5A9. Use a different number combination for other ear. Now the normal patient repeats initial sequence correctly. If the patient responds incorrectly, so go for the second time with different letter combination. And if the patient repeats at least 3 out of the possible 6 numbers correctly. Conduct further testing by audiometry. Take two tuning forks of 256 Hz and 512 Hz. Place the base of the tuning fork on the mid forehead. Place the base of the tuning fork on the mastoid bone behind the ear level with the canal. This is Rini test and sound heard is longer in air than bone. And now we'll continue with the examination of the eye. To test the acuity of central vision, we'll use the Snellen eye chart. And position of the patient should be 20 feet from the chart. And now ask the patient to cover one eye with card and to read the smallest line of print possible. A patient who cannot read the largest letter should be positioned closer to the chart. Note the intervening distance. Visual acuity is expressed as two numbers. Example 20 by 50. The first indicates the distance of the patient from the chart, and the second, the distance at which normal eye can read the line of letters. For early detection of lesions in the anterior and posterior visual pathway, we have static finger wiggle test. Place the hands about 2 feet apart, lateral to the patient ears. Now wiggle simultaneously and bring them slowly forward, curving inward along the imaginary surface of the bone towards the central vision line. And now kinetic red target test. Move a 5 mm red topped pin inward from beyond the boundary of each quadrant along the line, bisecting the horizontal and vertical meridians. Ask the patient when the pin first appears to be red. And now survey the position and alignment of eyes and check the eyebrows and eyelids and width of the palpebral features or any edema of the lids and color of lids and any lesions or condition and direction of eyelashes. Briefly inspect the regions of lacrimal gland and lacrimal sac for swelling. Look for excessive tearing or dryness of eyes. And also examine the conjunctiva and sclera of the eye. And now we'll go for light reaction. Pupillary size changes in response to light and to the effect of focusing on a near object. The pathways diverged in the midbrain. However, impulses are transmitted through the oculomotor nerve, the cranial nerve number 3, to the constrictor muscle of the iris of each eye. Now, this completes the